it's going to be a blast from the past, so to speak. A little over 3 years ago, health agencies, they're all across the nation, they were stockpiling billions of dollars in personal protective equipment, or PPE. We started using that acronym, things like masks, gowns, respirators. Now it's all reaching the end of its shelf life, and a new investigation finds the cost of that unused PPE is being passed on to taxpayers. Dre Clark has more on this investigation. Dre?
Yeah, good morning. We're talking about tons and tons of once precious medical equipment now expired and millions of your tax dollars wasted. A massive collection of personal protection equipment, or PPE, is now going to landfills all across the country. States are stuck with years worth of supplies. We're talking about gowns and gloves and masks and also those protective shields, all items that actually come with an expiration date. So it is a use them or lose them situation. And now an investigation reveals the massive scale of waste that's been uncovered. Now, from coast to coast, again, all across the country, city and state public health agencies, along with other state government entities, are getting rid of their stockpiles of PPE. There is way too much supply left over from the pandemic and too little demand, and the materials are now beginning to expire. The Associated Press did an extensive investigation revealing that at least 15 states stretching from Alaska to Vermont have tossed out much of their PPE because of expiration dates, surpluses, or a lack of interest in taking the equipment off their hands. We're talking about more than, get this, 18 million masks, 22 million gowns, 500,000 gloves, all thrown away. That means millions and millions of your tax dollars pretty much flushed down the toilet. Now, there's been some effort to try and save some of that money. The Associated Press discovering, for example, the state of Ohio auctioned off around 390,000 hospital gowns and took in a paltry $2,500, nowhere near the amount of money they paid out to actually buy the equipment. In Maryland, that state disposed of more than $93 million in PPE supplies, and Rhode Island said it got rid of 829 tons of PPE. Some states are keeping a portion of their supply as a precaution, but anything set to expire must be thrown away. Now, the AP says during the beginning months of the pandemic in 2020, states spent more than $7 billion on things like ventilators and other medical devices and equipment. The AP says it reached out to all 50 states with questions about PPE stockpiles, but only about half responded. So it's hard to get a full national accounting of just how much money is now being wasted. Many of them wanting to make it clear, though, that they have distributed far more gear than they have discarded, and they are really going out of their way to try and donate what's left. Now, one emergency response director says perhaps federal regulators who are responsible for setting these expiration dates may want to revisit that actual process to try and find out if any of those dates can be extended. And that could perhaps cut down on so much of the waste that's happening right now. Markie,
yeah,
Adrienne?
A lot of different ways to talk about it, but I'm curious how a hospital gown expires. Someone's going to have to explain that to us. We still have questions. Dre Clark, thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.